Welcome to another edition of the DAMY Vlog. My name is Dr. David Duizer. I'm a naturopathic doctor focused on the prevention and holistic treatment and holistic management of chronic disease. Thank you so much for tuning in. Today on the show we're talking about shift work and the significant impact that shift work has on our overall well-being, our overall health, and on our disease risk. I'm not sure if you're familiar, but in 2007 the World Health Organization classified shift work as a probable carcinogen, something that probably causes cancer long term. Their mechanism of action for this was the disruption in circadian rhythm, the disruption in the sleep-wake cycle, your body's natural waking and resting rhythm. We know this has impacts on many different areas of the body, but their position and the position of reports since 2007 have been that mortality, the risk of death is increased, and that can be through a few different mechanisms that we'll cover today. So the reason I'm very passionate about expressing this information to everyone is because a significant percentage of my patient population is doing shift work. And it's really important for me and for you, if you have family members or if you yourself are doing shift work, it's really important for all of us to know the long-term implications this has on our well-being and our health in general. Shift work is really, really hard on the body, and today we'll talk about some reasons why and maybe what to do about it. So when I speak about shift work, we're talking about people who work through the night, some nights a week, usually 3 to 5 nights a week. Off and on, they'll work through the night and then they'll try and flip back to a normal schedule the rest of the week. This, if you're in it, you know how difficult this is, and if you're in it, you know the negative effects it has on your body. It usually causes fatigue, it causes cravings and overeating, it can cause significant amounts of stress, it can be very, very hard on the system, not to mention the impact it has on your social life and on hobbies and on happiness in general. Shift work is really, really, really tough on the body. I understand the reasoning for some people to want to get into this type of work. Usually it's nurses who are extremely passionate about their job and really, really like what they do, who stay in it the longest. And it's just so important for them to know the impact that it could have on their health. So today I'll talk about that impact a little bit, just by highlighting some of the stats I share with my patients. So since 2007, since the World Health Organization came out with this statement about probable carcinogen, shift work being a probable carcinogen, we've discovered a few other things. If you work shift work off and on for a period of 6 to 14 years, your risk of all-cause mortality or death in general is 11% higher than the regular population, which is significant. If you work for 6 to 14 years in shift work, there's an increased risk of cardiovascular disease by 19%. There's an increased risk of cardiovascular disease by 23% if you work more than 14 years. 15 years or more, increased risk of cardiovascular disease by 23%. That's significant. And what they found out from the nurses study in this very large trial, that population-based trial that was done in the 80s and 90s, they found out that if someone worked shift work for a period of 15 years or more, their risk of lung cancer was increased by 25%. That is crazy. That's so high. The mechanism of action for this, of course, is the disruption in the circadian rhythm. What does that do to the body? Well, we know it does a series of things. It can alter testosterone release. It can alter cortisol release, which can affect insulin release. It can affect the nervous system in the brain in the sense that it can cause a fight-or-flight type of response, too much time in this fight-or-flight mode versus rest and digest. It can reduce immune function. I was listening to a podcast on Peter Attia's The Drive yesterday, and he was interviewing the Why We Sleep author, Dr. Walker, and he was saying about how they found out that one night of 4 hours of sleep decreases natural killer cell activity by 70%. That is crazy. We have these cells that help us clean up the body every single night, and in doing so help us prevent the spread of cancer, the growth of cancer cells. Natural killer cells play a main role in that. They're suppressed significantly with just one night of sleep, one night of lack of sleep. So not sleeping well has a significant impact on our immune system in other ways as well. So what are we going to do about all of this? We know that shift work is really bad for our health. We can also infer from this that having a social jet lag where you have some nights where you stay up really, really late and then you try and catch up other nights can be probably just as bad for you, especially if you're doing every single week. We know that if you're working really, really, really late into the night, some nights, and then trying to catch up others, it's going to have a negative effect on your well-being because it's going to disrupt your circadian rhythm. People who do this, they notice how, okay, the next night they can't get to sleep at the proper time. They're up a little later. They lose an hour. That's the jet lag from staying up too late. This is really bad for the health long term, for the well-being long term, and the mechanism is through the circadian rhythm disruption. So the importance of sleep is absolutely significant. We are the only species who makes the choice to not sleep. It is unnatural for us to not sleep at the same time every night for an extended period of time, specifically between 7 and 9 hours, not less than 7 and not more than 9 if you're over the age of 19. But regulating your circadian rhythm is extremely important to your long-term health in the reduction of disease risk. So that's really, really important for us all to be talking about and for us all to be sharing with our patients if you're a clinician, clients if you're a practitioner, and family members. When you really, really care about your family and friends, you got to tell them, gosh, you got to be sleeping. You got to be sleeping. We're in a culture, in a society right now where it's a badge. People are expressing their lack of sleep as a badge of honor. Okay, I'm a hard worker. I'm grinding. I'm doing this. I'm doing that. And there's a potential there that they may not know the impact that it could have, this type of living, on their long-term wellness and specifically on their disease risk. We're talking about all-cause mortality, cardiovascular disease, and cancer, all three. Shift work really, really bad for you. So if you've been in a period of shift work and now you're out of it, you've gotten out and now you're trying to sleep better, what can you do? Well, it really depends on your type of insomnia, whether it be onset insomnia, the difficulty falling asleep, or maintenance insomnia, the difficulty staying asleep. Recommend consulting with a naturopath or your medical doctor to try and figure out what to do. Do your best to stay away from medications if you possibly can, and try everything lifestyle to optimize your sleep. We're having a lot of success with circadian rhythm management through blue light therapy, like I've shared on this channel before, through stress reduction, supplementation, and lifestyle practices like breathing. We're having a ton of success with lifestyle changes like making your room cool and not eating before bed and doing all these things. They're really, really important. Not having caffeine after lunch, staying away from alcohol and drugs. These things are all so important to optimizing your sleep. And that's without speaking about hormone release and progesterone level, thyroid management, all of these things that can be disrupting of sleep. We see hyperthyroid cases come in here as people can't sleep at all. We see cases of severe depression and anxiety where people have a really, really difficult time sleeping. Make sure you're not in a category where you're dealing with a condition that will affect your sleep negatively. If so, try to optimize the absolute best you can. Thanks for watching today. I really want to start a conversation around improving sleep and to help as many people as possible reduce their long-term risk of these significant stressful conditions through the optimization of lifestyle. And we need to hit diet, we need to hit weight goals, and we need to hit sleep goals. These things are all really, really important. Thank you so much for watching. If you like shows like this and you want to learn more about holistic well-being, please subscribe. We'll do more like this. Have a great day.